Welcome, everyone. Thank you so much. I'm Dr. Javier Sanchez. I'm a family physician with Kaiser Permanente, and I'm also the program director for the Inland Empire Climate Health Action Coalition. Thanks again for joining us for this latest webinar. In the last year, you've been joining us for multiple webinars discussing climate health and what we can do here in the Inland Empire. We've learned so much, and I'd like to thank you for joining us for all of our webinars. Today, we're very, very lucky that we're going to finish our webinar series by talking about what our community is doing here locally. So with that, I'm going to pass it on to Ms. Allison Elsner to introduce our two speakers for today.
All right, thank you so much, Dr. Sanchez. We really appreciate you all being here. And before we get started, we do want to remind you about our upcoming Climate Convergence Conference on May 30th. And as we go along, we'll put information in the chat on that. It is free to attend. It's Friday, May 30th, 8:30 a.m. to 2:30 p.m. And we have some amazing presentations scheduled and a couple of great keynote presentations as well with breakfast and lunch. So we would love your support and attendance at that. All right, let's get started today for our 6th webinar in our series. We are very excited to welcome Jasmine Hutchinson, MSPH, who is the Director of Community Benefit at Loma Linda University Health and the Associate Director for the Institute for Community Partnerships. In these roles, Ms. Hutchinson collaborates to design transformative strategies that foster a thriving Inland Empire community. She also chairs Loma Linda University Health's Environmental Sustainability Committee, bringing together leaders from across the health system and university to advance climate-smart healthcare. Ms. Hutchinson holds a Master of Science in Public Health, specializing in health policy and management from the University of North Carolina at Chapel Hill. She completed the Executive Education for Sustainability Leadership Certificate Program at the Harvard T.H. Chan School of Public Health in 2024. Welcome, Jasmine Hutchinson. And we also are very excited to have with us today Ryan Lauer, MD. Dr. Lauer is an anesthesiologist at Loma Linda University Health. He currently serves as the Chief of Cardiothoracic Anesthesiology, and he's the medical director of all the operating rooms. Dr. Lauer's commitment to Loma Linda University Health and our local community runs deep. Not only has he been on faculty at Loma Linda for nearly 17 years, but he's the only anesthesiologist in the health system to have provided patient care in the room in which he was born. Dr. Lauer grew up in Redlands, where he currently lives with his wife and 3 kids. Welcome, Jasmine Hutchinson and Dr. Ryan Lauer. Take it away.
Thank you so much. Good afternoon, everyone. It's a pleasure and an honor to be here today.
Good afternoon for me too. Jasmine's going to get started with the presentation, and I will add an interesting clinical operational anecdote in the middle. But very happy to be here, and just thank you so much for the invitation.
Thank you so much. All right. So actually, before we get started, if you wouldn't mind putting in the chat kind of your role, your organization, that'll be helpful, especially when we get to kind of the question section. Would love to hear a little bit. If you have anything to share about sustainability, feel free to pop that in as well. So environmental sustainability is a natural extension of our mission to serve our community, safeguard health, and steward the resources entrusted to us. Today, we'll explore why healthcare needs to take an active role in reducing its environmental impacts and provide some insights into how you can jumpstart or expand sustainability efforts within your organization. We'll also share some lessons learned from our own journey. Next slide, please. This is a photo taken last September of our own medical center and children's hospital in the foreground and the line wildfire raging close by. It's a stark reminder that climate change is here, impacting our community. Events like wildfires and extreme heat aren't just environmental crises, they are health crises, worsening respiratory illnesses and disproportionately affecting vulnerable populations. In the United States, the healthcare sector accounts for 8.5% of total carbon emissions. If healthcare were a country, it would be the fifth largest greenhouse gas emitter in the world. As healthcare professionals, we take an oath to do no harm. Every single day, we work to protect and care for the well-being of our patients. But here's the hard truth. Our hospitals and clinics are contributing to the very burden of disease we seek to alleviate. We have an ethical duty not only to treat the patients in front of us, but to safeguard the health of future generations. And that means integrating sustainability into our clinical practices and operations. Let's take a moment to talk about how environmental pollution impacts health. And I know you had a chance for some of the other webinars to hear more about this. But I wanted to just touch, in case folks hadn't heard all of this, what it means for healthcare in the Inland Empire. So fossil fuel emissions are taking more lives globally than AIDS, malaria, and tuberculosis combined. That's asthma, respiratory diseases, heart attacks, conditions we see in our hospitals and clinics every day. And here in the Inland Empire, we already have some of the worst air pollution rates in the entire country, making these health impacts even more severe. And then there's plastics and toxins. Microplastics are now being found in placentas, brains, and lungs. And while we're saving lives, we also rely on materials in the healthcare system that sometimes contribute to the problem. But it doesn't have to be that way. There are alternatives. Pollution doesn't just harm health, it deepens inequities. It hits hardest in communities already facing high pollution and limited access to care, the very people we are called to serve. Healthcare's role in advancing climate health equity is threefold. First, our role is to detox and decarbonize, reducing our own environmental impact and moving towards safer practices. Second, we need to anchor resilience by making sure we're prepared to withstand climate impacts and support our community during climate crises. And finally, we need to lead by example, integrating climate, health, and equity into policies and inspiring others to follow. Because this isn't just about the environment. It's about health, it's about justice, and it's about the kind of future we want to build here in the Inland Empire together. Next slide, please. It's also important to note that younger generations care deeply about sustainability. In fact, 77% of college applicants consider sustainability when choosing a school. And over 50% of millennials research a company's environmental impact before accepting a job. This trend highlights a clear opportunity for any healthcare organization. Investing in sustainability isn't just about values. It's about staying competitive in a changing workforce landscape. In a region already facing a shortage of healthcare professionals, sustainability is a strategic advantage to help attract the next generation of clinicians, staff, and students who want to work for organizations that reflect their priorities. Next slide, thank you. Sustainability is the ultimate multi-solver. Multi-solving is a growing movement around the world. When people work together across sectors to address multiple problems with one policy or investment or effort, they are multi-solving. By focusing in on individual sustainability projects, we can reap benefits across so many different areas, including finance, reputation, talent, operations, community health, regulatory compliance, and of course, the environment. Next slide, please. So what steps can you take to advance sustainability in your healthcare setting? Next slide, please. Leadership buy-in is critical. To get started, you need support from both administrative and clinical leaders. As physicians, you can help identify and engage those champions. Another idea is to connect sustainability to what leadership already prioritizes: cost, risk, reputation, and mission. Highlight that it helps attract and retain staff, especially younger professionals. You can use examples from other hospitals to show that it's doable, and ask for visible backing, like adding sustainability to strategic plans or dedicating resources to support the effort. Next slide, please. Speaking of dedicated resources, I highly, highly, highly recommend convincing your organization to join Practice Green Health. Practice Green Health is a membership organization providing environmental solutions to more than 1,700 hospitals and health systems across North America. If your organization joins, all of your employees can access Practice Green Health's online resources, including practical tools, data, and expert technical support to meet environmental sustainability goals. This membership has honestly been a complete game changer for us, giving us the tools and resources to move quickly. On the website, you'll find a huge range of resources, including toolkits and best practice guides, checklists and calculators, live and on-demand webinars and with experts, case studies from other health systems, and with detailed cost savings data, sample policies and governance documents, and so much more. Next, it's time to start building a team. It's okay to start small and grow it over time. What's important is to make sure that it includes key decision makers across disciplines and those who are passionate about sustainability. You can ask other folks for feedback on who should be invited. To be honest, when we started our journey, we weren't really sure exactly who all was going to be at the table. But the more we started asking around, we started adding additional departments. We now have more than 50 leaders responsible for enacting change across our hospital and university system. These are some of the different departments and groups that are all participating in it. And we just launched in late 2023 for this environmental sustainability committee that we have, and we're fortunate to have this multidisciplinary team of leaders driving this work forward. Overseeing this effort, we have executive champions, which in our case includes our chief operating officer for the hospital system and our vice president for financial affairs for the university system. And those are also key roles to include in whatever group you come up with, whether it's a green team or a sustainability committee. That's kind of 101 of what Practice Green Health teaches as well, is having those executive champions. I also really want to acknowledge the passion and energy of the students and residents who were a driving force in launching the committee. It was their attention, their questions, their persistence that brought it to the attention, I think, of a lot of leaders. And it helped spark the initial sparks that we needed to start the committee. Next, you'll want your committee to identify clear priority areas. In our case, we selected 4 impact areas. Those are reducing waste, improving energy efficiency, greening our operating rooms, and adopting sustainable procurement practices. We're also focusing on 2 critical infrastructure priorities: building a solid governance structure to guide our work into the future, and collecting baseline data so that we can really track our progress and hold ourselves accountable over time. The next step is to try to align your sustainability work to a larger climate action commitment. In our case, we actually explored 7 different public-facing climate action commitments to identify the one that was the best fit for Loma Linda University Health. We had initially narrowed it down to the 3 boxes that are all in color here on the screen, and had our committee review in detail the advantages and challenges with each one. The one we selected was the new Joint Commission Sustainability Certification. We really felt, in our case, like the Joint Commission Sustainability Certification was the strongest fit because it aligned very closely with the impact areas we'd identified as our priorities, and it was brand new. It just launched in January of 2024. The criteria felt like it was achievable, and we have experience at our health system in applying for other Joint Commission certifications. So we have a process and a team who can help support that. And unlike a pledge, it really needs to be earned. They only sign off on it and sanction it after they've gone over your data in detail, your governance structure in detail, and your priorities. So In our certification process, we're going to focus on 3 key areas, which you can probably recognize from the earlier priorities I mentioned, which are waste disposal, energy use, and then anesthetic gas, which is we're thinking under the umbrella of operating room. It's also important to note that the Joint Commission recently modified or eliminated nearly 400 rules to make it easier for hospitals to reduce their environmental impact, including transitioning from single-use to reusable items. So if you hadn't heard that, that's a very exciting thing for many hospital systems. And then fourth, sixth, I should say, you can really build momentum for sustainability through quick win projects. So here's an example of one of the quick win projects we decided to take on. This is on the left-hand side. This is a lot of the respiratory equipment that we have, and we were using plastic bags over all of it. So to show that it was cleaned and ready for use, it had a plastic bag over it. And we are transitioning to this clean tag system where you can see it says clean device on the right. And this alone should save about 11,000 plastic bags from our medical center and children's hospital annually, and save about $5,000 as well. And this was a great quick win project because it was recognized by the Joint Commission as a best practice, actually. And our East Campus and surgical hospitals at Loma Linda had already made this transition successfully 3 years ago. And we just needed to kind of cross-pollinate that idea and bring it over to the other hospitals. Another quick win project we've been working on is reducing our environmental impact from anesthetic gases. So I'm going to turn it over to Dr. Lauer now to share more about our journey and why this work is so important.
Thank you, Jasmine. So Jasmine's been describing to you all what has happened here at Loma Linda and how we have really started to move the needle. You know, I just want to highlight the role that Jasmine herself personally has played in all of this. Without someone with passion and focus and really dedicated time for this, and I'm not sure how much of Jasmine's time is truly dedicated for this project. This isn't her first job, her only job, but without her leading this and championing it, we wouldn't have gotten nearly as many of these wins together. So just really wanted to give her a lot of credit here. There was a lot of talk on campus about these things, but really the organization and the structure is what's led to many of our successes, and now they're just multiplying. I'm going to give you an example today of something that is relevant to my world, and I'll show you why. Let's go to the next slide. Before we start talking about what we've done, I just want to orient everybody a little bit to what we as anesthesiologists do, and why these actual molecules matter to the environment. So, you know, just a little history of anesthesia here. Nitrous oxide was used, you know, 160 years ago, more than that, for the first time. And ether shortly after, chloroform shortly after that. But it wasn't until 100 years later that the first modern molecule for anesthesia, the so-called non-flammable anesthetics, came into use. Let's go to the next slide. And we have a special system for delivering these medications to our patients, and that system is called an anesthesia machine. In anesthesia, we literally live behind a curtain that separates the operative field and keeps everything in the surgery side sterile. It used to be called the ether screen because it separated the ether so the surgeon wouldn't get sleepy while they were performing surgery. Now we have a fully contained system to do that, and you'll see some pictures of our anesthesia machines coming up. I include this just to show you a little bit of how we deliver the anesthesia gases to our patients. So why are we talking about anesthesia gases? Well, on the next slide, you'll see anesthesia gases in the environmental footprint from Seattle Children's Hospital. They've shown this in their presentation and published on this. we're the only specialty that's specifically called out as showing their environmental footprint. Remember earlier, Jasmine mentioned that the healthcare sector is 8.5% of the total environmental carbon emissions in the country. Anesthesia gases are 7% of the 8%, so it's a significant portion. On the next slide, you'll see that sort of represented in a little bit different way, just to show how anesthesia gases, it's not just an American problem, this is a global problem. The next slide, break it down even further to look at just the operating room carbon footprint and show that the anesthesia gases can account for half of the energy, the carbon footprint of our operating rooms where we live and work on an everyday basis. Anybody who's been to an operating room realizes how freezing cold it is in many of them. That's so that the surgeons can stay cool under all of their garb, and also under the hot lights, but also we use a lot of disposable equipment in the operating room. So this was a very impactful graph for me to show my colleagues and help drive some change in our organization. On the next slide, you can see why the actual molecules matter. So when we compare a molecule of sevoflurane, which is the name of one of our modern anesthetic agents, you can see that sevoflurane is 144 times more potent than carbon dioxide as a greenhouse gas. Now, there are 3 main volatile anesthetics available for use in the United States. You see those: sevoflurane, isoflurane, and desflurane, but they're not all the same in their atmospheric impact. Desflurane is significantly, you see, 2,500 times more potent than carbon dioxide, just as a molecule. Now that's significantly different than sevoflurane. So one thing that we've done is we've decided to just eliminate desflurane from our formulary. And there's reasons why one might want to have a variety of agents, but we've made the commitment to kind of do it the hard way and use essentially just sevoflurane in our health system. Now, many of you know of nitrous oxide as laughing gas, and nitrous oxide is used in dental offices. It's used as an adjunctive inhalational agent for anesthesia. And what we're going to talk about today is not totally eliminating it from our practice, but eliminating how it is being used wastefully simply because of the way the healthcare systems have set it up over the years. And you can see how important it is for us to eliminate it. If we were to use nitrous oxide for an hour, that would be an equivalent of 49 miles for a car to drive on the city street. So it's very easy for us to eliminate it, and we're going to talk about how we did that. On the next slide, you'll see what we've been able to do in our system. This is looking at some of our data. And so just the nitrous oxide footprint at Loma Linda University Health was 486 metric tons of CO2. The picture shows you what 1 metric ton of carbon dioxide would look like if we were to put it into a sphere. Now, the frustrating thing is that about 80% of that nitrous oxide was totally wasted, did not contribute to the care of our patients. And this is where we felt like a quick win would really make a huge difference. So let's go to the next slide, and it summarizes a couple of these quick wins that we've done. So we're going to talk about abandoning nitrous oxide pipeline supply inside the walls of the building and using a more portable supply. And I mentioned we're changing our anesthetic types. And the last thing we can do is really how we deliver the anesthetic agents to patients by decreasing the amount we use over time. And that goes back to the way we use that anesthesia machine differently that I showed you earlier. On the next slide, you can see before Jasmine and Loma Linda started our environmental sustainability committee, we had made a commitment in our department, and I personally put in a lot of time to do some groundwork here. So you see two different styles of anesthesia machines. On the left, there's the black vaporizer that puts the desflurane into the breathing system. On the right, you see the blue little canister there. We basically just went around before we even went to the pharmacy and said, let's take this off formulary. We just removed the delivery vehicles. So anesthesia providers at Loma Linda would have a hard time even finding desflurane because we knew about its environmental potential. On the right is something that our EMR, we at Loma Linda use Epic Health Systems EMR. And Epic is trying to be a leader from the electronic medical record community on providing feedback to clinicians on their environmental impact. And they have a dashboard that we implemented so that we can break it down by provider what our total carbon emissions is with anesthesia gases. So we had implemented this and now are leveraging that to create change. So now let's dig in a little bit on the piped nitrous oxide supply. On the next slide, you can see our working group. So it really does take a wide group of people from the anesthesia side, our techs that supply us with our equipment, OR nursing, and really the facilities team is instrumental here. The biomed, and then also the medical gas vendor supply chain. We included finance so that we could get our baseline data and really developed a great team to work on this together. So let's go to the next slide. I see a question from Allison in the comments there. We'll talk about how nitrous oxide is commonly wasted inside health systems in just a minute, but it's a really good question. What we used as our roadmap, you can literally see the roadmap on the screen here. Providence Health System has been a leader in this, and they've created what's essentially an open source process for health systems to use. And I guess one hope of mine for today is that even if we don't have health system leaders on this conference, but that we can sort of motivate any of the participants to go back to whatever areas of influence they have and ask, hey, in this surgery center or in this hospital, could we help drive the same change that we're seeing at Loma Linda? We certainly weren't the first in the state to do this. The UC systems have mostly started down this pathway with nitrous oxide. Some of them are further along than others, also Stanford. So we feel that we are, with the pack that's out in front leading this, but we'd like to see this get out into our community even more, into the many numbers of private surgery centers and other hospital systems in our community in the Inland Empire. This toolkit can help. On the next slide, you can see it's broken down by responsibilities, by phases, with check marks, how to stay organized. All right, so now on to the how we did it and what are some of the general principles. On the next slide, you can see how important it was that we not change the quality of care we are delivering to our patients. In no way are we cutting corners whatsoever. Our patients' safety and lack of awareness while they are under anesthesia is paramount to us. We want to have safe, comfortable, asleep patients coming for surgery in our system. We're not providing less anesthesia, we're simply eliminating waste. And we're doing a stepwise process so that we could, if we did run into a problem, we could roll it back and sort of reassess. Okay, now let's go to the next picture. And this is going to be a start of talking about how the nitrous oxide can be wasted inside a health system. We learned lessons at from some of our other academic systems in the state that we don't want to talk about nitrous oxide leaks because that infers that we have a problem with our facilities. but there are some mechanical issues with the way nitrous oxide is delivered to the end point, to that anesthesia machine that I showed you the picture of. And one of the most important areas of waste, and I've characterized this for our teams by saying, we've built a highly reliable, highly redundant system for something that doesn't really need it to be so. Nitrous oxide is an adjunct agent to most anesthetics. It's not the core of the anesthesia. So what happens, this is inside the ground floor of our new hospital in Loma Linda. TMC stands for Troche Medical Campus. And this is our gas supply room inside the TMC. You can see two parallel arrays of these big blue bottles. These are called H cylinders. They're about 4.5 feet tall, and they hold quite a bit of compressed liquefied nitrous oxide. And they are set up in two parallel arrays of 20 cylinders each. And when one system starts to become low, it automatically switches to the other. And we have continuous supply to all of our clinical areas through all of the copper pipes inside the walls. So what happens is when one of these systems starts to become depleted, it switches to the other side. And then the medical gas vendor is notified that the cylinders are getting low. They come, switch them all out, all 20 of them, and install new ones, then take them back to their plant where because of this regulations and high reliability, the cylinder is completely depleted before it's filled again. So all of that nitrous oxide is sent to the environment, no matter how much of it we send back to them. This at Loma Linda, this is the highest area of loss to the environment of nitrous oxide, is because of the high reliability method whereby we refill our system. Now, there probably are some leaks at joints and manifolds at the areas of delivery, but that's closely monitored and that's not the biggest area of loss. One area where we do see loss, on the next slide, you'll see another array. So these are two other arrays that we have just here on campus at the main campus at Loma Linda. Every operating room in the country has something similar to this. And a similar process for replacing these H cylinders. Now let's go one more slide and you'll see the back of an anesthesia machine. So you can see the smaller blue cylinder there in the middle circled with red. This is called an E cylinder. So all of our anesthesia machines already had redundant supply for how we deliver nitrous oxide. And what we do when we use these E cylinders is we shut them down every day and in between cases so that nothing is being fed to the system. Anesthesia machines, we came to find out, by their design, bleed just a little bit of the nitrous oxide, about 2 milliliters per hour of nitrous oxide out of the system. But that's happening across our system at about 55 machines a day at 2 mils every hour, every day. And that's intentional, that's by design, but that adds up over time. And so that's another way that we lose nitrous oxide to the environment. So what we've done is essentially take away that wall supply. You can see this hose coming in right there in blue into the back of the anesthesia machine. And what we've done is we have taken away the wall supply, but we still have nitrous oxide available for every anesthesia machine in our system with this more secure way. We were worried that we were going to have to be changing these all the time if we didn't have the wall supply. So one of our tools in the Providence Health Roadmap showed us how to get that data from Epic that I showed you earlier from their dashboard and display it so we could really understand how much nitrous oxide we were using in our system on the patient delivery side, not on the acquisition side. So let's go to the next slide. And you can see that we were able to quantify how many liters of nitrous oxide we were administering. And this is broken down by our main different operating room sites. And you can see that the Children's Hospital is the biggest utilizer. There's a reason for this. Children come more anxious to surgery than parents. We can't expect a little baby or a 2-year-old to hold still as we're putting them to sleep or putting an IV in. Most adults go to sleep with medicine in their IV. Children, we try not to poke them while they're awake, so we hold the nitrous oxide over their face. They get a little bit sleepy from that, and then they can breathe themselves off to sleep, and we can put in an IV after they're asleep. A pretty common way of anesthetizing children, but it does lead to increased usage. With this data, this is how we were able to calculate what I showed you with that big sphere on the screen, and we could realize that we were not even delivering about 80% of the nitrous oxide that we were purchasing as a healthcare system. Some of it was lost to the environment through the walls and the connectors and the anesthesia machines. Much of it was being sent back to the manufacturer or the air gas plant for refilling canisters that weren't completely depleted. On the next slide, you'll see a little picture of how the nitrous oxide comes to us from the wall supply. So our first steps were to simply leave everything as is, but disconnect at the wall, just to see how we would do with using the mobile supply, those smaller E cylinders rather than the big H cylinder wall supply. And I will say that this was essentially a non-event for us. We disconnected from the wall supply. We literally cut the cord, and we had no clinical complaints from any of our anesthesia providers in our main campus. As of today, we're taking the next step. On the screen, the next slide, you can see that. So today we're actually depressurizing the system that carries the wall supply inside the main campus hospital. And then the final step will be a complete decommissioning of that system and not purchasing any of those big H cylinders anymore in the future. We will continue step by step to our other ORs inside the Loma Linda system, and then probably take that even to our remote campus in Marietta at some point in the future as well. So we have about 4 different buildings to complete here in town in Loma Linda before we take it down to our remote campus in Marietta. But our commitment is to continue to look for opportunities everywhere we can find them. We're gonna, that desflurane that we're not using very much, we're gonna take it all the way off formulary. And then we have some how we practice anesthesia initiatives to go forward. We're gonna leverage those provider report cards that Epic gives us the opportunity to do, so that people can really understand for their own self how much they're using, and we'll try to use the competitive nature of doctors and our nurse anesthetist team to really see who can use the least environmental footprint in the way they conduct their anesthetics. I just wanted to say thank you again for the opportunity to speak. This is my last slide. It has been an amazing journey for us to do this. We're not done. We have so many things that we can do. And Jasmine's going to go through a few of the other operating room items, but also the other health system items that we are working on at Loma Linda. Thank you again.
Thanks, Dr. Lauer. Dr. Lauer has been an amazing clinical champion of this project and all of the anesthetic gases, and we're so lucky to have you working on this with us, Dr. Lauer. Before we conclude, I wanted to highlight that there are so many opportunities to implement sustainability within a healthcare organization. Here, I wanted to share a few more examples of what sustainability looks like for us at Loma Linda. Our cardboard baler recycled 325 tons of cardboard last year. Our repair shop reupholstered 60 to 90 pieces of furniture monthly, breathing new life into furniture and avoiding landfill waste. We've actually had this reupholstery department for about 20 years. So this is a longstanding, sustainability started way before we put together our committee a couple of years ago. We also diverted more than 3,600 pounds of those little pulse oximeters from landfills last year through a special recycling program. Under energy efficiency and renewable energy, we've completed our first large solar project on the faculty medical office's parking lot. It will help us minimize the need to reschedule or cancel patient appointments during utility power shutoffs, which was an issue for us in January this year. So we're looking forward to that building in some resilience for our operations. The Shut the Sash program in our laboratories aims to cut lab energy use by 85% by reminding our scientists to close the fume hoods in their laboratories. That's basically, shutting the windows of your house, right? When you don't need them open to save energy. We now have 70 electric vehicle charging ports on campus, and we're planning for more. We have a unique culture and of vegetarian campus, which has greatly minimized our greenhouse gas emissions from food. And of course, that's been there for many, many years. In addition, our Healthy Harvest program brings locally sourced produce to our cafeteria, which helps to cut down on the carbon emissions of transferring food from different locations. And it also supports local farmers. To reduce our food waste, we're working towards rolling out a new app to help connect leftover edible food on campus to hungry students. And then we also recently updated a policy for our operating room to permit the use of reusable scrub caps in those operating rooms, which is especially popular with our surgeons. So each of these steps moves us towards a more sustainable future. So we're really thinking through how can we spread and scale our impact. And I wanna, you can go to the next slide. And most importantly, in this conversation, how can you support sustainability? So in addition to kind of the roadmap I provided of how a health system should think about the work and start organizing and moving things forward, I also wanted to leave you with a few tangible steps that you can take today to advance sustainable healthcare in your context. So the first is really identifying your personal role and responsibility in advancing sustainable healthcare. Sustainability is everybody's job. I work in public health. I'm not even in the clinical side, and it's really everybody's job. So no matter what your role is. So utilizing your own power to advocate or convene others can be a good step. If you're an educator, you can integrate the impacts of climate on health and sustainability into your clinical teachings. And then we're asking each of you to also apply an environmental lens to your work to help identify opportunities for greener options. It's usually the folks who are closest to that work who have the best ideas and who see where the waste is and where those opportunities are. So you can kind of, as you're reviewing during procurement process, when you're reviewing or requesting new items, you can ask yourselves questions such as, is this product necessary? Is there a sustainable alternative, like a reusable or eco-friendly version? Is the packaging it comes in wasteful, and can that be negotiated with a supplier? What happens at the end of its life cycle? And do these, like for example, do the office lights get turned off at night that you have? Is the temperature of your location optimized to prevent waste during periods of non-use? So those are just a few ideas of how you might be able to apply an environmental lens. But what we've seen is those folks who started doing that, it really starts building, and they come up. Once you start doing it, it's hard to stop seeing new things. And so we've, a lot of the folks who've started initial ideas have come back, and we've implemented additional ideas that they've come up with because they're continuing to apply that environmental lens. Third, you can highly recommend connecting with others in your institution, especially across disciplines. You can identify champions and listen to their ideas. And sometimes it honestly doesn't take a lot of people it just takes the right group coming together. So for example, with our scrub cap policy, it was our chair of the Department of Surgery, who's an amazing sustainability champion, Dr. Loma, coming together with one of our leads in infection prevention, and another person who is one of the vice presidents of perioperative services. And the three of them talking it out, figuring out, yes, we can make this policy work. Yes, it does comply with all the regulatory requirements. And they were able to move it pretty quickly just with 3 people. So, but it really does require kind of getting out of your own bubble and, connecting with other folks who can help to drive some of that change. So Fourth, I'd say convince your organization to join Practice Greenhouse so that you have the tools and resources to get started in your journey. Next slide, please. Let me leave you with a final thought. I'm deeply inspired by the wisdom of the San Manuel Band of Mission Indians, who consider how their decisions today will impact 7 generations into the future. It's a perspective that challenges us to think far beyond our immediate concerns and to ask ourselves, what kind of legacy do we want to leave? Let's take bold steps together to build a healthier, more resilient world for generations to come. Thank you. Happy to take any questions for both of us.
Wow, that was fantastic. Thank you, Jasmine. And thank you, Dr. Lauer, for that great presentation about what our institutions, our healthcare institutions are doing here locally. This is fantastic what you've taken here to do at Loma Linda. I think you join a number of big time institutions in the state, as you mentioned, Stanford, the UC system, Kaiser Permanente, to really move forward on reducing our carbon emissions and really try to make sure we're aware of our carbon footprint. One of the things that I think it's important to understand as we move forward with this is to really think about sort of the scopes of the carbon emissions that we produce in the healthcare system. And sometimes it's easy to think about some of the simple things that we can do, like Jasmine was mentioning. So the scope 1, which is the direct on-site emissions that we produce, which you talked about quite well. Number 2 was the scope, which is scope 2, which is the indirect, and that primarily focuses more on how we purchase our energy. Are we getting solar panels to run our hospitals? Are we getting wind mills to run our hospitals? Things like that. And then the third thing, which oftentimes we don't really think about, is the scope 3, which is another indirect, which is what we do personally, conferences that we go to, where we're purchasing our supplies. How do we get to the hospital? Loma Linda has done a fantastic job with all those charging stations, encouraging people to have EV vehicles to come in and utilize that to reduce, again, our carbon emission that we do. So this is fantastic work that you guys are doing, and I applaud you because you guys are the leaders here in this community. And because of the work that you've done, I think we've seen some of the other hospital chains in the area to start thinking about their own emissions and what they can do. And with the help of the state, the help of healthcare leaders like the California Medical Association, we're moving forward to make sure that we make it available for these healthcare industries here in the state that can be fully aware of what their carbon emissions are and how we can all work together. So with that, any questions from anyone to our speakers?
I don't see any questions in the chat, but I have a question for both of you, Jasmine and Dr. Lauer. Obviously, we know that change is an evolutionary process. It takes a while, and you two are incredibly strong, dynamic leaders in this and communicating the need for this and the methods for this. Are you hopeful that this is making progress, or do you feel it's an uphill battle? Do you find yourself encountering resistance, or is it starting to gain traction?
I think within our own health system, I haven't encountered, honestly, a lot of resistance. People have been really supportive. I think the biggest challenge has just been, other time commitments and kind of the normal competing priorities, right? But everybody that we've come in contact, that I've come in contact, has been, really supportive and of a lot of this work. I think, we have to start with where we're at, and we just need to continue to make progress where we can, and not despair at the fact that we're over the 1.5, Celsius threshold, that You know, things are getting hotter and we're starting to really see that ramp up even in this region. I think it's even more reason the urgency is there for us to continue doing more. And we're also working on sort of climate resilience work and trying to build that into the narrative, and how we can support community, at least on the more public health side of things. So,
You know,
go
I
ahead,
think
Dr. Lauer.
something that's been really helpful here at Loma Linda is having engagement from hospital leadership all the way to the top, and being able to see hospital leadership at the Environmental Sustainability Committee is really inspiring for those on the ground doing the work. And I think that's an essential step. Jasmine mentioned it in, you know, her slide deck, but I just want to reemphasize that and express my own appreciation to that group for their degree of engagement. You know, as a physician, I've been and medical director, I've been involved in asking the hospital for money in various different ways, you know, whether it be for supplies, equipment, whatever, medications. But, you know, this is an interesting area where doing the right thing for the environment can actually save money. And, you know, we're not going to get huge cost savings from eliminating nitrous oxide. It's actually surprisingly inexpensive to purchase. And even though we'll be purchasing less, we're not going to get huge savings. But every little bit helps. And, you know, what we've asked for is a commitment. And I think we've gotten that from where we find savings. Maybe there's an area where we can spend a little money to save some money in the long run. And I think that they're definitely engaged on that in sort of taking the quick wins where we can and then refeeding it back into the environmental sustainability initiatives. And seeing that has been actually really inspiring too.
I do have a question, because one of the things that comes up a lot, and both of you mentioned this takes a lot of time to plan. You're very engaged. You also have other responsibilities that you have to be aware. So how do we motivate other healthcare folks, healthcare professionals, to really take the lead? Because our communities are looking to us. They're looking to us as leaders. They're looking to us for answers. So how do we get more engagement from our healthcare professionals to really get them to the point where we're not the only ones, or we're not the only one of two in our institutions, to keep moving forward with this?
I'll let Jasmine take it first. I have a thought, but I'm curious to hear what Jasmine will say.
So how do we get this engagement? I think with physicians, I think what you all are doing in terms of the education piece is critical. We need to not stop thinking about sustainability and environmental health as somehow separate from other types of healthcare that we provide, when there are such strong links and these impact the same populations. So I think that, you know, that tie and focus is really important. Dr. Lauer, what are your thoughts?
Well, you know, you mentioned it earlier, Jasmine, getting students involved, getting young people involved really generates a lot of positive energy. And, you know, I think that education, really just getting the word out, is what has really created a core group of people that are willing to give their own time for it, Dr. Sanchez. So creating positive messaging, letting people know the little things that have happened already, really builds momentum for the projects. So that's what we've seen here. You know, I was introduced to a couple students through that are interested in this through a totally separate QI process. You know, we'd had our own thoughts about anesthesia sustainability with gases and supplies, and it wasn't really until the students started pushing it and talking about it that I personally committed all the time necessary to do it. I mean, we all have a passion for things, but making that step to commit to create change I saw that in myself. And then at the same time this committee was starting. And so just really getting the word out was made the difference for us at Loma Linda. And I think now we have this core group that it's this sort of self-perpetuating process.
Yeah, just to add on a little bit, I think there's often a desire, but what can be missing is that connection to the right other people, to who you need to actually move the needle with, right? And get buy-in. And so I think I think about sort of hierarchical networks and adaptive networks, and these adaptive networks where they're kind of closest to what's happening. They usually have the best ideas. They want to pilot those ideas sometimes. And it's about kind of connecting in, getting the permission from the hierarchical network so that they can actually do that. And they have the free reign to run with pilot projects, to report back. And so it's the connectivity piece, I think, that can be, really helpful between these different groups.
So we still have time for any other questions. Feel free to raise your hand if you have a question or a comment.
Got a quiet group today.
Wow, quiet group today. Okay.
No more questions, huh?
I
Okay.
will just add, one of the things that I love most about sustainability is there's not really ever any competition, right? We're all on the same team, no matter if we're at different organizations. We're all just trying to make the earth better, or, populations better. And so, and I think that's can be kind of unique in this field, is that everybody I've met has been willing to, share documents, share stories, help other organizations kind of fast track what they're doing, because we all win when that happens. That's one of the brilliant things about Practice Green Health. We're totally willing to do that as well. So if there's other organizations, in the Inland Empire who just want to chat about the process, or what they, if they need resources, feel free to reach out.
Awesome.
Well, with that, thank you, Jasmine. Thank you, Dr. Lauer, for that fantastic presentation. Really excited to see everything that you've been doing there at Loma Linda. Look forward to seeing more work. And as you already know, you guys are sort of the blue zone sort of giants here in the area. Everybody looks to you to see what we can do next for sustainability. So it's great to see that. And I'd like to thank you all for joining us once again. This is our last webinar, but it's not the last time we're going to get together. I want to make sure that I invite you, and I want you to invite as many people as you want to join us at our in-person conference that will take place on May 30th. We have some fantastic speakers that will be joining us again. We're going to have Dr. Swain, who started this with us, to really, again, come back and emphasize the importance of climate and what's happening, especially here in the Inland Empire. We have Dr. Abraham. If you haven't heard him before, he is a fantastic climate physician that is really pushing the envelope on our communities of color in terms of climate. We have folks from the American Lung Association that are going to come in and tell us why that's important. And we also are going to have individuals here from the Inland Empire, both from Riverside and San Bernardino County public health departments, letting us know what we're doing here. So please, again, I want to invite you to join us. Registered, feel free to share this information with anyone. At the end of the conference, we want to hear your comments, because we want to do this again next year. So if you have any ideas of what we can do for next year to continue this webinar series, please let us know. And with that, enjoy the rest of your lunch, and thank you so much for joining us.
Thank you. Great job.
Thank you very much.
Thank you. That was awesome. See you guys soon.
Bye bye.
Bye-bye.